Hi friends, welcome to classes by Lab Doctor. In today's class, let's see what are the tests which are available with us to detect blood in the urine. So you all know when we say hematuria, it means blood in the urine or RBCs are seen in the urine. So what are the causes for hematuria? Renal, extra renal. So the causes which are related to the kidney could be because of IgA nephropathy, glomerulonephritis, Alport syndrome, thin basement membrane disease, etc. Non-glomerular could be because of renal stones or because of an infection, pyelonephritis, renal tumor, polycystic kidney disease, sickle cell disease, renal papillary necrosis. In the ureter, there could be some tumors, there could be a trauma, there could be stones, or there could be infection, or there could be a stricture which might be causing hematuria, or there could be a bladder tumor, there could be infection, stone, or chronic irritation which might be causing hematuria. Similarly, the prostate, there can be a trauma, there could be a benign prostatic hyperplasia, there could be prostatic cancer which can also cause blood in the urine, and urethra, there could be infection, there could be trauma which can be causing blood in the urine. So the most common way how do we detect the blood in the urine is by the reagent strip. So you might have seen the reagent strip like this. Usually it is yellowish in color, that is negative, that is in normal. Sometimes you get the various hues of yellowish to purplish or greenish. So this is a non-hemolyzed blood which you see trace and moderate. So you are seeing this background and the specks which are seen, and these are the hemolyzed blood. Hemolyzed is it is completely broken down, and that we grade it as traces, small, moderate and large. So this is negative, this is traces, and this is positive. So in the dipstick evaluation, this is based on what is the principle on which this test is based. The hemoglobin on contact with the peroxidase substrate causes oxidation of the chromogen indicator, and it causes the color change. And this whatever heme is there or whatever blood is there, it can come positive in case of hematuria, hemoglobinuria as well as myoglobinuria. So all three will give you positive on the dipstick. So what is the principle of this dipstick test? Remember that the hemoglobin, what is there in the RBCs, whenever there is patient is having hematuria, he has RBCs, and the RBCs will be having hemoglobin. So this hemoglobin has peroxidase activity. So this peroxidase activity in the hemoglobin will decompose the hydrogen peroxide which is impregnated in the dipstick, and it will release the nascent oxygen. So this nascent oxygen, it will oxidize the benzidine which is present to give a blue color. So this is the principle of the dipstick test. This is also what we do in the benzidine test. We take 2 ml of urine and we add 1% of benzidine solution in acetic acid. Acetic acid helps to lyse the RBCs and release the HB. And then when we add a hydrogen peroxide, if at all we are getting a greenish or bluish color, we say that it is positive. So in the urine dipstick also, if it is negative, it is yellowish in color, and whenever there is the color change, it indicates either trace, moderate, weak or strong amount of blood in the urine sample which is received. So here when we correlate it, if the dipstick is giving you traces, that means usually in under the high power field we usually see around 0 to 2 cells per high power field. Suppose if it is 4 plus on the dipstick, it usually means that there are around 18 to 20 RBCs on the high power field. So this is the negative dipstick and this is the positive dipstick which is given a greenish color. When I say it is traces, it is around 10 cells per microliter. When I say it is large, it is around 200 cells per microliter. So that is what we say here. It is from traces, small, moderate and large. So this is in cells per microliter. So, but you should also remember that it can sometimes give you a false positive reading. Just because it has come a blood positive, that doesn't mean there is always blood. It can be seen in various other conditions also, like I've told you, like in case of hemoglobinuria, the benzidine test or the blood test will come positive. In case of myoglobinuria, you will get a positive test. So this you will have to remember. Suppose if the urine is contaminated with a menstrual blood, though there is actually no bleeding, but because it is contaminated with the menstrual blood, there is hemoglobin there, it will give you a false positive result. Suppose if the patient is dehydrated and the urine is having a very high specific gravity, then also you can get a false positive result. Sometimes because of exercise etc., you might get a false positive result. Sometimes if the urine sample is contaminated with the semen, then also you will get a false positive results. So this, just don't think that you got a positive result always it means blood. It can be because of hemoglobinuria and also myoglobinuria. Whenever you get discolored urine, you will have to ask the history and symptoms of the patient has to be inquired. Suppose if the dipstick is giving you blood plus and the microscopy also shows that there are more than 3 RBCs per hyper field, that means it is hematuria, and hematuria can be because of glomerular as well as non-glomerular causes. Suppose if you got dipstick positive, but when you saw it under the microscope there were no RBCs, that could be because of hemoglobinuria or myoglobinuria. So in hemoglobinuria and myoglobinuria, the dipstick will show blood positive, but the microscopy will show nothing. There will be no RBCs. Sometimes what happens is dipstick will give you blood negative, and also microscopy also will give you RBCs negative. That means the urine, just the urine is reddish in color, but the dipstick is also showing negative, and the microscopy also there are no RBCs. So that is base of pseudohematuria. As I told you, when you have something reddish like in beet or certain drugs like rifampicin, certain dyes can give you that color. So these are the various causes and how do we correlate with the urine microscopy. So what are the other tests for urine in blood in the urine? It could be enzyme assays, we have absorption spectrophotometry, we have immunodiffusion techniques, we have even electrophoresis to diagnose blood in the urine. So this dipstick method is the most common method which we use to identify blood in the urine. Very handy test, but we will have to correlate it with the urine microscopy, patient symptoms and other clinical factors. So thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.